We have a question coming in from Lisa, and it's about, what you experience after a procedure. And it's two parts, why a patient has significant bruising following an endovascular procedure, and also about the pain. What is normal pain following a procedure, especially an intervention? But she's also asking about surgical, if bypass or endarterectomy has the same type of pain following those procedures.
In general, recovery from an endovascular intervention is shorter than a surgical bypass, and it depends on the extent of surgery and the extent of the endovascular intervention. The bruising that you can see sometimes as a result of an angiogram or some type of endovascular intervention in the legs is most typically because of one of two things. One is we give a short-acting blood thinner during the procedure, and so that it usually has a very short duration, though. But a lot of these patients we will have on what we call antiplatelet therapy, or medicines like Plavix or clopidogrel or other similar type medications, and that thins the blood. And so when we're done with the procedure and we take that little tube or that sheath out of the artery, sometimes there is some bleeding under the skin. And as long as that doesn't become expanding over time, if the area remains soft afterwards, then that discoloration basically amounts to a bruise, and it usually goes away with time. In terms of the pain after an intervention, some of that also is dependent on the type of intervention that you had. If you're aggressively ballooning an artery, for example, in the superficial femoral artery, which is the main vessel in the thigh, if you have to really dilate that because it's heavily calcified and you dilate it aggressively with the balloon, some patients will feel that afterwards. And I usually tell people that usually lasts 24 to 48 hours. It gets better with a little bit of time. Some anti-inflammatories can sometimes be helpful, but in general, the recovery from an endovascular intervention is within a few days, whereas the surgical bypasses take a little bit longer to recover from.